Welcome to Medcast. Here, we delve into the latest breakthroughs in medicine, equipping you with knowledge that can enhance your health and well-being in day-to-day life. I am Dr. Wafaa Faisal. I am a consultant pediatrician in Dubai. And my guest for today is Dr. Maria Karakulaki. Dr. Maria Karakulaki is a German board-certified obstetrician and gynecologist. She has a master's degree in gynecologic endocrinology from Greece. She had finished her fellowship training in cosmetic and reconstructive gynecology from the United Kingdom and the United States of America. She is a lead in aesthetic and functional gynecology, and currently she is the medical director at King's Aesthetics. Dr. Maria, welcome to Medcast.
Thank you very much. Good morning, Dr. Wafaa.
Good morning. I'm so happy and I feel privileged to have you with us today because we will discuss very interesting topics with you that are very relevant to all women who will be watching us, from menopause to the urinary incontinence to aesthetic gynecology. So these topics are new, and I'm sure that many, they are hearing about it, but they don't know exactly what they are.
Exactly.
So we will start.
Thank you so much for having me. Thank you so much for giving me the opportunity to talk about all these very, very interesting topics, yes, which, as you said, they are not yet that popular. Women don't know, and women, they suffer many times for many reasons, and they suffer in silence. They suffer alone. They don't know to whom to talk. They don't know that there is treatment, and I'm very happy to discuss all these things with you.
Yes, thank you very much for being with us. And for all the women who are watching, really, I'll tell you that this episode, this podcast is for them. I will start with the first question. Tell us a little bit about your journey. I mean, as an obstetrician and gynecologist, what made you reach what you are doing at the moment?
Mm-hmm. Yes, so I studied, as you said, in Germany, medicine. I worked there. I did my residency, part in Germany, part in Greece. And for many years, I was working as an obstetrician mainly, gynecologist, but mainly obstetrician. So I delivered many, many babies in my life, which was so fulfilling and beautiful. But then at some point, at some stage, that was approximately 7 years ago, I decided that I wanted to do something different. First of all, I did also a master in gynecological endocrinology because hormones was always my passion, and I wanted to understand from the very small age, you know very well, you're a pediatrician, adolescents, how many changes are happening, hormonal. So until menopause, I was very interested to see there hormonally what's going on. So I studied that for 2 years. I was doing obstetrics and this kind of things, endocrinological issues in gynecology for many years. But then, yes, I decided that I wanted to touch also base to something else, which is was a very big need from women, like what we do after delivery. After delivery, we might have some issues. What we do. True. So for all these things, there was nothing really much to do. True. It's nothing that we learn in the residency. It's nothing that it's popular and every gynecologist is familiar with. So you have to go and study it further, and this is what I did. And since the let's say 7 years approximately, I do only that.
That's brilliant. And I want to comment that what you said about hormones and menopause, and these are areas that really we feel there is still a need.
Yes.
And not many gynecologists know about it or are experienced, in this part of medicine. And we are hearing a lot about hormone replacement therapies and these things. And you need to know who is the person, who is the one that the women can trust and can take the advice from when it comes to this very delicate, I can say, area. And the other parts of what you are doing at the moment also is something very important to every woman. To having you as an expert with all this experience, I think we are lucky in Dubai. and
Thank you
to
so
have
much.
someone like you with all this experience and these innovations, I can say, in science that can help all the women in their day-to-day life and to bring the best out of them.
You know, I did it just because women asked for that.
Yes.
You know, it was again the need of women that brought me to do this, to study that and, dedicate myself to this. And when you say about hormones, that many gynecologists still are not very familiar and they don't feel comfortable to deal with hormones. The truth is, the story with hormones goes back to 2000. There was, up to 2000, every woman would take hormone when she would go to menopause. There was no discussion, no second thought. It was something very, very widely used. However, in 2000, there was a big study that came out, and what they did is that they put all women from all ages, with irrespective their medical conditions, let's say in one pot, every woman for 45 plus to 75 plus, in one pot they gave them synthetic HRT, an HRT that we don't use anymore.
HRT means hormone replacement therapy.
Exactly, yes, hormone replacement therapy. So one pill, the same pill for everyone, they gave them that and then they made conclusion out of that. So, and the conclusion were not really good indeed, but that means that it came out that HRT is risky for women, but again, it was not a well designed study. And after some years, there were many studies that were done meta-analysis. So on this study, you know, to study and see, is it really as they say? They checked many different parameters and they came to the conclusion that it's not like this. Not every hormone replacement therapy is risky. Exactly, Yes. And the truth is, which is evidence-based today, is that hormone replacement therapy, no matter what kind of hormone replacement therapy you are taking, up to 5 years is not increasing the risk for breast cancer. If we're talking about breast cancer, because that's the most,
linked to the hormones.
Exactly.
Risk linked to hormone replacement therapy.
So there is up to 5 years, there is no increased risk. After 5 years, the risk will be increased because of the synthetic progesterone, not estrogen. Okay. Of course, estrogen, depending how they will be metabolized in our body, they can cause damage to our body, to breast. But that's something that we can investigate and we can find out. And according to that, then take the right estrogen therapy that you need. Okay. So what I'm saying is that first of all, there is a big fear about hormone replacement therapy because unfortunately there is, I guess, not much interest from doctors to learn, to go beyond the study, which was 24 years ago, okay, and see what's new. And also there is not a lot of interest and knowledge about functional gynecology, which means to see deeper, in depth, how our body metabolizes the hormones, how our body is using the hormones. And according to that, then to have a personalized treatment. So there is not one pill same for every woman. That's not correct. That's
the importance of going to the expert, someone like you who's experienced in this field in particular.
Yes.
And now it's coming to the surface, this HRT with the longevity medicine.
Exactly.
We'll hear a lot about it, and I think a lot of studies will be done and probably are running at the moment.
Yeah.
I will come to the very important topic that every woman needs to know about, which is menopause. So we want to know from you, what is menopause, about the hormonal changes that occur in this time, and what any woman going through this process or approaching menopause should do, and how can science help her through experts like you.
Let's go to the definition. As you say, it's important because many times women are confused and they come and they say, I'm menopausal because I have whatever symptoms, but I still have my periods and they are irregular. So there is the stage where we call it perimenopause, which is everything around the menopause, before and short after menopause. And that can start even 10 years before menopause. The average age of menopause, so menopause means no periods for 12 months.
Wow.
Okay, that's the definition.
That's easy.
Exactly. So if you don't have your periods for 1 year, then you're menopausal. Okay.
Alright.
Now, before that though, even if you still have your periods, even if the periods are still regular even, you might have symptoms because of the hormonal changes that are happening. And that can be even 10 years before the menopause. Let's say your menopause will happen at your 50. You start when you are 40, 41, 42, and you don't feel yourself. You feel very tired. You feel you don't sleep well. You feel you have mood swings. Your libido is low, you are very irritable. Those are, you have brain fog, memory lapses. Those are the main and the most common symptoms of menopause.
Okay.
Hot flashes and night sweats, what we hear, mostly as the common symptoms, they are not that common. So out of 10 women, they will come and they will say, I don't recognize myself. I have become so moody. I was always a happy person. I'm always tired. I used to be so active. Those are the complaints you hear.
Yes,
You don't hear
yes.
about hot flashes.
Okay.
And that can start even in your early 40s.
Yes, 10 years before the menopause.
Even in your late 30s.
Wow.
Okay, so if you're, let's say, 37, 38, and you start having these issues, please go and see
Seek
your
advice.
doctor. Yes.
Okay.
There might be
you can help
something
the
starting.
premenopause as well as the menopause, or what can you do for them?
Yes. So look, it's what happens in the perimenopause is indeed that the hormones are changing, right? The female hormones, the estrogens, they are decreasing. So you can see what are the levels, and not only the levels. You can go in depth and see the estrogens, progesterone, androgens, all hormones, cortisol. You can see what are the levels, how your body using these hormones, and what you need. And then according to that, you can give hormone replacement therapy in a low dose, of course, not the same that you would give in the menopause. And by saying hormone replacement therapy, that might be estradiol, estriol, progesterone, androgens, testosterone. There are many things that you can do. You can fix the adrenal glands, the cortisol levels, because this is also very important. You can check the vitamins, minerals, what she needs from this point of view. So it's not only one thing.
Yes.
Yeah.
But there's a package, but that's great.
Yes. So it's great that there are so many things that we can investigate and find out where our problem is. Maybe it's not even the hormones, the female hormones.
Yeah.
Maybe it's an issue of your adrenals. Maybe you are really very stressed.
Exactly.
Stress, it's a big issue, right?
True.
Women will come, and weight gain is another issue, right? And they say, I do everything. I do exercise. I eat well, and I cannot lose weight. And mostly my weight is in my tummy.
Yes, tummy. Exactly.
And that can be just stress. Because cortisol, if that is high, doesn't help losing weight, right? Or if you don't sleep
is the root cause of all the diseases.
Yes.
So these women, when they go into this hormone replacement therapy, how are the results? What do you see?
Okay.
Is it a life-changing experience? Is it also helping in longevity, in anti-aging?
Oh, yes. I say to women, hormone replacement therapy is the best anti-aging treatment for all women.
This is a big promise for all of us.
Yes. And we can do it with a very safe way. Okay, so because, the reason to start hormone replacement therapy is for two reasons. One reason is because you have symptoms and you don't need to suffer. Very safely, you take your treatment and you feel well.
Yes.
Okay. The other reason, which is not evidence-based in terms that there is guideline and tells you have to do that. But the truth is that if you start early enough means close to menopause, close before, close after, then, and you take hormone replacement therapy, then you have many benefits. You have prevention of osteoporosis, prevention of cardiovascular diseases, which means stroke and heart attack.
Yes.
I'm sure you know that patients with the highest risk for cardiovascular diseases are women in menopause who do
Very
not take
true.
HRT,
Yes,
right?
yes,
Because
yes.
estrogen protects our vessels,
Yes.
our arteries.
True.
So if you go in a healthy artery and you give estrogen, then you just maintain this healthy artery.
Yeah.
If, of course, you go after 15 years in a non-healthy artery
It's not
and
the
you
same.
go, then it's not the same. Then it's not recommended.
Yes.
That's why the right window is very important. Then it's very positive for our brain function. So you see women, they come and they say, I have brain fog, memory lapse, and so on. They go on HRT and they feel so much better. They say, now I can focus. I'm, back to normal,
Yes.
how I was. Sexual life, it's very important. Our vagina needs estrogen. It's the main thing which keeps the skin inside the vagina healthy.
Yes.
You know, when we don't have estrogen in the menopause, we might have infections, vaginal infections, urinary infections, urinary incontinence. Then, or look, why should we look in our 60s like we were 80?
True. Very true.
Now 60s, in your 60s you have maybe a new life
So really, it looks like the
starting.
best anti-aging for women.
Yes, it is.
Really?
It is.
Brilliant.
It's so positive for so
yes.
many things. Yes.
This is very big promise, and this is very great news. It's a breakthrough actually for many women to know
Yes.
that the hormone replacement therapy, how important it is to them, in the right window before menopause.
Yes.
The second most important topic, because there are so interesting topics I need to cover as much as I can.
Sure.
Urinary incontinence. We all know that women, when they go through many pregnancies and childbirth, and how the area will be affected and how they can have this incontinence when urine can flow involuntarily, if we can say. So how can you help these women? We heard about surgical treatments, and I don't know how successful they are. And we want to know about if there are available non-surgical treatments, because I've heard about some chair, I want you to speak to us about these advancements in this area.
Yeah. So urinary incontinence is indeed a very big problem, and it's bigger than we think, because I'm sure that there are many women that they don't talk about it. Even to the gynecologists, they will not address the issue.
Unfortunately,
unfortunately,
they feel ashamed.
They feel ashamed, or many times they think they have to leave embarrassed, or sometimes
they have to live with it.
Yeah,
yes,
you have,
it's
okay. I had my
because
children. It's normal,
kids, and I'm done. No.
Yeah, exactly. No, it's not. It's not like this. And usually are very young women that will be affected. So you have finished with your children. You are what? You are 35, 40, 45.
You have a life to live.
Of course. Even 50. When it comes in the menopause, you're very, very young. So it depends now what the severity, let's say, of the condition. If it is very severe, or if it is a mild to moderate. If it is very severe, then yes, you have to do the surgery. Then there are things that you can do to improve, but you will not be treated. However, if it is mild and moderate, then there are non-invasive things that you can do. So the urinary incontinence, and mainly the stress urinary incontinence, meaning that when you're coughing, sneezing, laughing, jumping, running, you will have some leakage. So in that case, what you need to do is to strengthen your pelvic floor muscles. Usually they are not strong enough. And also you have to strengthen the support of the urethra, where the urine will come out. So you do that, you work on two levels. One is the pelvic floor, and there is an amazing chair. It's FDA approved. It's called Emsella chair. It's electromagnetic field. The energy that comes out from the chair. So you sit on the chair, first of all, with your clothes.
Yes.
You sit for 30 minutes. So, and you feel some vibration. This vibration is the energy that comes out from the chair.
Yes.
And this vibration is actually contractions. You get 11,000 supramaximal contractions. The supramaximals means very, very strong contractions that you yourself cannot do. We can do only that much. We can't do more.
Yes.
But the machine can do it for you. So you get this very strong contraction. It's not painful. And with that, the muscle, let's say, from that thin becomes that thick. It's like you do a very, very strong exercise, right?
Yeah.
But it's, how easy it is to do 11,000 contractions yourself.
Yes, no one.
No one. Yeah, and that's only one
Yes,
session.
yes.
And usually you have like 8 sessions, twice a week for 4 weeks.
Yeah. Was there any comparison between this chair and the Kegels exercise? I know it's very difficult, such kind of studies.
Okay. I will just try to show you, because there are diagrams that show. Let's say the Kegel exercise, the strength that you can go, it's up to this. Okay, so that's the maximum. Okay, with the machine you get up to this, it lasts long and goes down.
So definitely there's
I think you understand.
Uncomparable, I think, benefits
it
from
is.
this chair.
It's good to do
Yes,
Kegel
yes,
exercise,
yes.
yeah? Definitely.
Other things than this chair.
Exactly. So that's what we do for the pelvic floor. Then we have to work in the vagina because the urethra will come out from the anterior wall of the vagina.
True.
So there we can do laser. There we have the energy-based devices. So laser, radio frequency, and then we have also take some tools from the regenerative medicine like PRP, which is platelet-rich plasma, or growth factors or exosomes are coming now, which are amazing.
Yes. Everything that applies to skin and aesthetics and
The
dermatology,
face,
aesthetic dermatology can be applied. It
Exactly.
seems, to other areas.
Exactly. Yes, definitely. And you have rejuvenation, the same as you have with the laser, with the radio frequency. You have rejuvenation in your face. The same thing you have also in the vaginal wall, and that goes underneath the urethra and supports the tissue, makes the tissue underneath the urethra stronger.
Yes.
Okay.
Yes.
And at the same time, as side effect, you have vaginal rejuvenation. That means that you have better lubrication, you have better sensation,
Yes.
you have vaginal tightening,
Amazing. So you led me to the other topic that we want to discuss. How about the intimate life? How experts like you can help the people who have certain problems in their intimate life.
Yeah,
what are the
absolutely.
common
Yes.
conditions that you face in your
Yes,
practice?
so there are many conditions. One very common condition is vaginal dryness. Women in the menopause or even in the perimenopause, because of the hormonal changes, they will have vaginal dryness. So vaginal dryness is one. The other very common thing is that they say, after the deliveries or after even the pregnancy with C-section, still the pelvis is very stressed. So they say after the pregnancies, my sexual life is not the same anymore. It doesn't feel that tight, it feels loose, the sensation it's not the same. And also sometimes they will say, I feel like a pressure, that means that the wall it's very loose, and when they are coughing or pushing, the bladder will push into the vagina. So those are the common complaints that they come with. And this is where you can help with all the devices, with injectables that we do, and they are not painful. Nothing of all of this is painful.
So I will move now to the topic that people are talking about it, thankfully now, more and more in our region, which is the aesthetic gynecology. So we are grateful because we are in a place where it's like a medical hub in Dubai. All the new technologies or the new research or the anything new in medicine is available in Dubai. So and you are a lead in aesthetic gynecology. So tell us.
Yeah, aesthetic gynecology is the artistic part.
Yes, the artistic part. What
yes.
techniques you are doing? What do you fix? I mean,
yes,
on
yes,
what levels?
yes.
I think there are different also.
Yeah. So, many women are just not happy with the appearance of their intimate area. Just like you're not happy with whatever, the texture of your skin, whatever, and you would like to change
wrinkles,
it. Yes, wrinkles, dryness.
Pimples, dryness, exactly.
Yeah, so the same applies for the area, and this is where aesthetic gynecology comes and helps with non-invasive treatments. We can do many things to improve the appearance of the skin there, or give some volume, and can help also with surgeries like labiaplasty.
This is
for
the
example.
aesthetic makeover that you do?
Yeah, the intimate. Yeah,
intimate makeover.
exactly. So the intimate
I saw it on your
over.
Instagram page.
Yes. So intimate over, it's a word that
It's
I
famous
like.
now. Yes.
I like
yes.
it to use it because it's exactly the same thing like the mommy makeover, right? Why the
Yes.
mommy makeover is so
Exactly.
popular and so
Yes.
accepted,
True.
right? No one will question someone who will do
Yes.
mommy makeover.
Yes.
So same thing, you can change everything
Yes.
whenever you want, if you want, there
Yes.
as well.
There's a need for it, of course.
If there is a need,
yes.
many times we have to say that. Many
Yes.
times I will have women coming and saying, okay, I want you to examine me and tell me what I need to do. And then the first
They're
thing
willing for a surgery, for example.
for a surgery, for
Yes,
anything,
yes.
tell me what I need to change, what you don't like. And I'm telling you, look, I will not examine you. If you think that I should tell you what to change, then we don't need to continue because you don't need to do anything. All of these things, it's like you go to the plastic surgeon and you say, okay, look my face and tell me what I need to do, what I need to change. Do I need to do, rhinoplasty?
She's not sure because it's just, something.
That's okay, then we discuss
If
and
there's
so
something
on.
bothering the person.
Exactly.
Like when
This
you go
is-
to the doctor, if you have headache, if you have toothache, you go to the dentist. So it has to be tailored for a need.
Exactly,
Yes.
exactly. You go to your dermatologist, plastic surgeon, okay, and you say you want to do Botox. Or when I started Botox, actually I was 30 years old, and I have these wrinkles here which I hate. And I knew. I went to the plastic surgeon and said, I want these wrinkles out. They make me look very angry.
Yes. Okay.
So you know what bothers you, and you go
And for
you
this, they
fix it.
make your life easier because there is a need for this.
Exactly,
Yeah.
exactly.
And many times you refuse to do certain things if there is no need for
Yes,
for it.
yes. Or I will, I will just tell them my honest opinion.
Yes.
Like, that's totally normal what you have. There is nothing usually there is nothing abnormal.
Yeah, reassurance will be great.
Yeah,
Yes.
it's just if you want to improve something, if you would like to change something. All labia, all vaginas, they are normal and there are different anatomical variants.
Yes.
Okay, now if the variant that you have doesn't you don't like it and you want to change it, then yes, there are things that you can do.
Okay. That's so good. That's so brilliant. And we're happy. It is really very precious information. So, Dr. Maria, what's your final message to the women who are watching us? Because someone
Yes.
like you is really adding value to women's life. I think also to men's life, because the women we
Of
are
course.
their partners.
Yes.
So, and it's very well known that if the woman is happy, a happy
Absolutely.
wife, happy life.
Yes,
So
true.
So
Yeah.
everyone is happy, and the role that all women play is very vital in our life. So they are the mothers, they are the sisters, they are the
Definitely,
daughters.
definitely,
They are
so many
everything. They are
roles,
yes.
yes.
So they give life together,
Yeah.
of course, with men. So what's your message to them at the end of this podcast?
So my message to every woman is not to be scared to talk. Whatever bothers her, she should feel confident enough to go and address the issue. And if she doesn't get the answer that she's seeking for, then just look further.
Seek further,
Yeah,
yes.
it's not one opinion.
Exactly.
Many times might be not enough.
Exactly.
Many times we have
Yes.
to look further.
Very
Yes.
true. Very true. In
Yeah.
medicine, especially, because
Oh, yes.
you'll have different opinions, different expertise.
Exactly.
Yes.
We're humans as well,
Yes,
right?
yes,
And
yes.
we have our opinion as well.
Exactly.
So maybe your opinion in something doesn't suit to one patient, but will suit to someone else. So we have to find the person that we trust,
Very
and
true.
just move on with this person.
Yes. Thank you very much, Dr. Maria Karakulaki.
Thank you very much for having me, Dr. Wafaa.
Thank you. Our
Thank you.
pleasure.